Hello. We are Diabetes Consciousness and we're here to show you solutions for your health. Today we will answer a very common concern among people with diabetes about the medication used for its treatment. To answer this question, let us consider which territory of type 2 diabetes develops. Obesity is today considered an epidemic that affects millions of people worldwide. Causing direct and indirect effects on health is the ground on which metabolic diseases such as diabetes and cardiovascular diseases develop. Looking for a solution to obesity and diabetes, people implement conventional diets, exercise, medications, or miracle products that reverse the problem without success. With these measures come constant high and low blood sugar, increased anxiety, hunger, cravings, failures, and guilt because nothing seems to work. There is a blind spot in the approach to the problem, not knowing that there are underlying conditions in overweight and diabetes. This approach simplifies the issue to a linear relationship between excess carbohydrates and insulin levels, or extra calories and fat burning, promoting relapses and preventing effective solutions. Both overweight and high blood sugar are not diseases. They are symptoms of an underlying illness or imbalance that is unobserved. Staying focused only on the symptom leads to wanting to eliminate it through a medicine, looking for a cure without going to the root that produces it. Just like the driver of a car whose red temperature light comes on to warn that something is wrong with the engine, and instead of going to the real cause of what the alarm wants to show, he covers the light with tape to solve the problem. The same thing happens with medications in diabetes. The repressed symptom gives the false illusion of healing. Understandably, it's a priority in a vital emergency to take medication to avoid a significant complication. However, although necessary, it is temporary and is not the solution. So it's not a solution that, over time, the drugs that started working stop working. Or doses must be progressively increased to keep the symptom quiet. Or worse, patients switch from one medication to another to get symptoms quelled with countless health side effects. So what to focus on for a real solution that works long-term in diabetes and overweight? It's crucial to make the following insight. We invite you to familiarize yourself with 3 determinant concepts that are the background, terrain, in diseases, in this case, diabetes. 1. Toxicity. 2. Acidity and inflammation. 3. Poor nutrition. We must work on these 3 aspects, not by eliminating the symptom, in this case, high sugar levels with medication, but by implementing measures or programs that promote balance in these 3 aspects, thus going to the sources that nourish the disease. We invite you to continue to the end of the video. You will learn about the guide and implement it into your lifestyle harmoniously and safely forever. We also invite you to subscribe to our channel and, if you like to, give a like to our video. If you want to expand on topics such as detox in diabetes, we invite you to visit our blog, where you'll find this and other topics of your interest. Let us know if you found our content helpful. We appreciate your comments. Let's continue. Let's take a brief look at each of these topics. 1. Toxicity. During life, toxins such as sugars, fats, and chemicals accumulate in cells, tissues, and organs, altering their normal functioning. The greater the degree of intoxication, the greater the health complications and damage to the body ranging from mild to irreversible. In diabetes, the liver, pancreas, and other organs need detoxification. 2. Acidity and inflammation. Toxins produce acid metabolites that promote chronic inflammatory states. There is an intimate and highly coordinated association between metabolic and inflammatory pathways. The evolution of inflammatory processes culminates in degenerative diseases. In obesity, a chronic low-grade inflammatory process is generated, which is also present in associated diseases, such as type 2 diabetes, hypertension, dyslipidemia, and heart disease. This chronic inflammatory condition is also related to insulin resistance. 3. Poor nutrition. Generally, people consume too many calories and not enough nutrients. People can be overfed but at the same time undernourished. Nutrition is the fuel that keeps the engine running. Proper nutrition is obtaining, assimilating, and digesting all the nutrients in food so the body can do what it needs to do, function, self-regulate and even lose weight. Cellular nutrition cannot take place if the cell is intoxicated. Choosing detoxification and strategic nutrition processes to work on these 3 aspects of the disease allows higher systems, such as the nervous system and the hormonal system, which ultimately control the information and biochemistry of the body, to reset and begin the repair and creation of new tissues. Health then appears and remains natural and spontaneous. Health is normal, not the disease. So, the answer to this is, can diabetes be cured without medication? Yes, it can. As carriers of wellness in diseases such as diabetes, it is essential to educate and inform people by broadening the view of what health and disease mean in human beings. We want to broaden your view on this subject so that you can choose to take charge of your health by knowing possibilities beyond the conventional opinions. We invite you to click on the link in the description. You will have the opportunity to learn about a powerful program designed from this biological approach. This information is designed to directly and effectively impact the 3 factors of metabolic disease in the first 2 months. After this time, your lifestyle will change forever. If you want to know more about topics related to diabetes, we invite you to subscribe to our channel and to activate the bell to be the first to receive notifications of new topics about diabetes. And if you want to visit our blog, click on the link below in the video description. Remember to like and share this information if you find it useful for you. And remember to comment your doubts or suggestions below. See you soon.